With a report on a condition that affects over 10 million Americans, dry eyes, here's our reporter Laura Windsor.
The eye depends on the flow of tears to provide constant moisture and lubrication to maintain vision and comfort. When the eye becomes dry, it can be the source of irritation. We spoke with Dr. Jonathan Pernazar of the University of California Irvine Medical Center to find out about new treatment options.
Dry eyes is a condition that can affect the eyes in many different ways. In one way, it can be very symptomatic. The patients can have burning, can have irritation, can have blurred vision. And the most common symptom of dry eyes is actually excess tearing. To answer the question exactly what is dry eyes, it's so multifactorial, but basically it's really two things. One, it's a lack of tears being produced, number one. And number two, the quality of the tear is not great. So therefore the tears that are being made, there's a lot of inflammatory particles in the tears. And because of this inflammation that we really can't see except with under the microscope, these tears are not sticking, and therefore they're not a good quality tear, and it's not a good functioning tear film. There's a lot of different ways to diagnose dry eyes. One is very much just looking at the patient, putting in special dyes, and looking to see if there's dry spots on the cornea and on the conjunctiva, which is the white part of the eye. We also will actually measure their tear production over a certain period of time. We put little strips in that over 5 minutes we see how many tears they're producing in 5 minutes. And under a certain amount is thought to be considered dry eyes. Using artificial tears is a way to prevent dry eyes, but you're going to be using artificial tears if you have dry eyes anyways. But I would say if you have dry eyes, you want to prevent it from getting worse, then using artificial tears and other treatment parameters out there is the way to prevent it from getting worse. There are many different treatments out there, and if there's one thing I can emphasize is that the treatment really has to be customized to the patient, because the simplest treatment is using artificial tears over the counter. There's a lot of different drops out there that are very good. Number two is punctal plugs is another treatment parameter that is also very good. What these plugs do is the drainage system of the tears is right in the corners of your eyelids. There are little holes there that drain into the nose. And your tears are made underneath this bone right here. They flow across your eyes. And by actually putting a tiny little plug in there that's less than 1 millimeter in size, we are actually keeping your own tears in your eyes longer, therefore bathing your eye in your tears so your symptoms are less with regards to dry eyes. Another excellent second line option rather than artificial tears is a drug called Restasis, which has been FDA approved. It's actually the only FDA approved drug for treating dry eyes. And what that is doing, it's actually attacking that inflammation parameter that we talked about with regards to the tear film. It's lowering the inflammation of the tear film so the tears can stick better to the eyes. We actually started, when I came here to UCI about 4 years ago, we actually started a dry eye support group. And immediately it took off because so many patients are suffering from it. And we meet once every 2 months. And we have about like 30 to 40 patients come in just learning about how to do these treatments. And there's a lot of over-the-counter treatments that also work well too. But it's good for people to kind of be in touch with other patients, because a lot of the treatment out there there's a pill called flaxseed oil, which is over the counter, which can benefit patients with dry eyes as well. There are some herbal remedies that are also over the counter that can also help treatment, or to help treat patients as well.